Hello, everyone. My name is Marietta Angelotti, and I've had the pleasure of working with most or all of you over the last 3 years on this project, and the pleasure of learning from you. You've all taught me so much, and it's been wonderful, and it's great to see you all here today. Thank you, Dr. Zucker, for your remarks and recognition of the achievements of the hospital medical home hospitals and clinics. They've been many, and for helping us understand the bigger context of our changing healthcare system. We're so glad you could be here. I'm so pleased to introduce our next speaker, Dr. Morris Singer, who many of you have heard about and seen. He has built a national organization to advocate for primary care, and in doing so, he has focused not just on primary care doctors, but on the whole interprofessional team. So just to get started and kind of segue into his talk and what he's tried to teach us, and all of you have tried to teach us about the importance of the team, we'd like to see what members of the team are here in the audience today, because we know there isn't just doctors. So I'd like to have you stand for a moment if you're a member of a care team. If you are a patient navigator, care manager, or care coordinator, could you stand up, please? Do we have any patient navigators here? Great, great, thank you. Great, it's wonderful. Thank you for coming. I know we have nurses here. Do we have nurses in the audience today? That's great, thank you. Yeah, primary care residents, I think I saw some rolled up things for posters somewhere, so I think we have some residents. Thank you for getting away from the hospital. And we actually, Saritha Rajupet came and did a practicum actually with us at the department on patient-centered medical home and learning about how to do this stuff, so thank you so much for coming to see us again. Do we have any depression care managers in the audience today? You're probably so busy, right? Do we have some? Oh, that's great. That's great. Thank you. How about clinic managers and staff who work in the outpatient clinics? Do we have anybody able to get away from the front desk and referrals? Great, thank you. And attending physicians, of course. Attending physicians. You're so important, teaching all of us. Thank you, that's great, that's great. I'm so excited that we're all, learning how we're all part of the team caring for patients. We're all probably going to be patients someday, so we all know how important all of you are, all of we are, to taking care of patients. And thank you, Dr. Singer, for really bringing that out with your work. Dr. Singer trained in internal medicine and is a clinician, educator, and advocate who founded Primary Care Progress, an interprofessional trainee-led movement to reform primary care delivery and training with 43 chapters across the country. He is a former community organizer and writes and speaks regularly on the value of primary care, the use of community organizing strategies to advance innovations in care delivery and training, and the critical role of trainees in the revitalization of primary care. Dr. Morris Singer is a lecturer in global health and social medicine at Harvard Medical School and an affiliate instructor in the Department of Family Medicine at Oregon Health and Science University. He earned his medical degree at Harvard Medical School and completed his residency at Brigham and Women's Medical Hospital in Boston, Massachusetts. He currently lives in Portland, Oregon. Please join me in welcoming Dr. Andrew Morris Singer.
Can you hear me okay in the back? Excellent. Okay. So let me just load this up. All right. So I'm a Mac guy, so forgive me here. All right. Okay. All right. Well, first of all, thank you so much for having me here today. It's incredible to be here with you, with the full glorious primary care team. Let's just lower this a tiny bit. So this is awesome. So I have nothing to disclose. Other than the fact that I grew up in New Jersey. I feel like you go in front of a group of people from New York and you're from Jersey, you gotta talk about it. So I actually recently translocated from Boston to Portland, Oregon. Now, it's really cool in some ways. I mean, it's gorgeous, but we don't get the sun very often. It's really cool because I now get to wear my, my hipster facial hair, which I never got to do before. But at the same time, I discovered the other night that my spouse is reading a bedtime reading book, and the title is Our New Pet Chicken. So that's Portland for you. So here's the thing that's really exciting, I think, right now. There's a lot of us in healthcare who are looking outside of healthcare for ideas about how to solve problems in healthcare. Right, so we've got folks looking at the manufacturing, aviation industry for help around quality improvement, patient safety. We're looking at the concierge industry, service industry, figure out about patient-centeredness, right, customer satisfaction. And increasingly, we're seeing people looking to the world of community organizing and advocacy for ideas as well. Ideas about how to mobilize power and resources to fix big problems. Ideas about how to build effective teams. And ideas about how to revitalize and reinvigorate a community of our colleagues. And in particular, we're seeing a lot of people in primary care using that movement language, talking about the grassroots. And that's exciting. And I think it makes sense because we have big problems in primary care. We all know that. And we know that we can't take them on without building teams. But I think we also know that we're not going to be able to do some of this work unless we can revitalize our community, right? Unless we can get some of us out of the funk that we've been in for a while. Now, I actually know a thing or two about community organizing. This is what I did professionally before I went to medical school in the LGBT community, the lesbian, gay, bisexual, and transgender community. So picture me back when I was 22, and I had earrings in both ears. I wore these black Doc Marten boots up to my knees, had a clipboard, a megaphone, and a ton of attitude. And back then, too, I also had this awesome six-pack, which is completely gone right now. Now, this was before same-sex marriage. This was when there was a wave of anti-LGBT ordinances taking off around the country, literally sweeping across the country. And my job was to go into those communities and help leaders build teams to take on some of those problems. And the job was basically to help some of those leaders get over their fear of asking other people for help, get over their tendency to do everything on their own. And when we were able to do that, when we were able to help those folks build some of those teams, we kept winning. We kept winning in Topeka, Kansas, in Tacoma, Washington, Bangor, Maine. And what I got to see over those years is the power of community organizing and grassroots mobilization. The power not just to fix huge problems by bringing resources together, but also the unique characteristic of this work where you have this beneficial and therapeutic effect for participants from the coming together. Right? When we went to these communities, these LGBT and allied folks, they were experiencing isolation. Right? This was back in 2000. They were experiencing marginalization, outright discrimination. They were feeling powerless in many ways. And through the coming together, through the organizing, through the wins at the ballot box, people started feeling connected. People started feeling like they weren't the only ones. People started feeling like they were receiving messages of support and value from their colleagues, their neighbors, their coworkers, and people started feeling power, empowerment. And if you want to know the legacy of that, it's this. It's the fact that myself and my husband and millions of other Americans 5 years ago started getting married in this country. Started feeling like we were finally part of Team America. What a remarkable, seemingly impossible thing that we accomplished working as a team. So that work had a profound impact on my thinking about how do we affect change? How do we take on really big problems? Right? But then it was time to take the MCATs, right, and go off to medical school. And I was like, okay, bye, community organizing. But here's the interesting thing. I get to medical school and ultimately go on to residency and realize I want to be a primary care provider. I want to be a primary care doc. And I'm experiencing all these challenges, right? All these obstacles, all this discouragement. And suddenly I'm like, wait a second. Why is it that it feels like primary care people share a lot of characteristics with LGBT people in this country right now? I mean, literally, there are a lot of us feeling marginalized, we're feeling ostracized, we're feeling devalued, discriminated against. And then on a light note, I was reflecting on the fact that my parents basically had the same reaction to me telling them I want to go into primary care that they had when I told them I was gay. Right? No! What happened? Now, look, am I suggesting that the plight of primary care people is the same as the plight of LGBT people in this country? No. But is it close enough? Yeah. Close enough for us to consider using the same social strategy, a community organizing strategy, a grassroots strategy, to try and affect change and pull our community out of the funk at the same time. That was basically the premise of our organization, Primary Care Progress, when we launched, that we could bring together campaigns at academic institutions led by students and residents to advance primary care, to bring the entire primary care community to advocate for new curriculum, new centers for primary care, and in the process, get a lot of primary care feel-good happening at the same time. We have 47 chapters now. They've run dozens of campaigns. And there are a lot of people in primary care who are feeling a lot more positive about where things are going. So my goal today is I want to share some insights from movement building. Specifically, how do we build connections with our colleagues? How do we develop effective, functional teams? And then how do we solve big problems that we might not have thought we could solve? And why do I want to do that? Because I think a lot of you are thinking about movements. You're talking about movements. Who here has heard about the family medicine revolution? Yes. Okay, well, it's coming to a theater near you. Right? More people are talking about movements. And for those of you that aren't thinking about movements, when you look closely at community organizing, there are actually a lot of really interesting things that we do that you might be able to do in your practices to build teams and solve big problems. Okay, so here we go. Movement building basically involves 3 steps, right? Essentially. Number 1 is you got to go from the me to the we. And what does that involve? That involves us stepping away from our Lone Ranger model of fixing problems, right? The Lone Ranger model that's probably, likely, responsible for a lot of our success to date. But we got to step away from that if we're going to fix problems. To build a team, we got to connect with another person, another group of people. What tools do we have to connect with others? And are we using all of them right now? Second step is we got to take that group of connected individuals and turn them into a functioning team. Now the challenge here